The skin of preterm neonate is immature in the immediate postnatal life. Therefore, it can easily be damaged and thus prone to antimicrobial attack. It is important to recognize potentially beneficial as well as harmful interventions which can affect skin integrity to optimize the outcomes and reduce the chances of acquired infections. In this webinar, we are going to learn about the infection prevention during various nursing practices related to cord care, care of vernix caseosa, bathing, care of nappy area, emollient application, care during application of adhesives. After clamping and cutting, the cord should be left dry in hospital settings and nothing should be applied over it. It is important to realize that the wet cord is an important breeding ground for pathogens and can serve as a source of infection. If umbilical stump is soiled, wash it with clean water and keep it dry. So, the bottom line is that nothing should be applied over the cord after birth and it should be always kept dry as far as possible. Vernix caseosa is a natural lipid rich substance adhered to skin at the time of birth. It prevents transepidermal water loss and thus helps in temperature regulation. It might also play a role in innate immunity. Vernix is automatically shed from the skin in the first 24 to 48 hours of life. As it is snugly adhered to skin, any attempt to remove vernix might cause damage to superficial layers of the skin. We know that the pathogens can gain entry from any portion of the damaged skin. Therefore, no attempt should be done to remove vernix from the skin after birth. The initial bath in stable full term neonates can be given once the temperature is stabilized. However, we have seen that the bathing in hospital facilities increases the risk of infection. Therefore, bathing should be avoided while the baby is admitted in SNCUs or any other hospital. In low birth weight or premature neonates, the bathing should be delayed until cord is fallen off. However, such baby should be sponged every day with lukewarm water. It is important to avoid soaps and cleansers in the first few weeks of life, especially in the preterm neonates. Routine use of shampoos for newborn skin is not indicated. However, baby shampoos can be used to remove crusts from the scalp. There should be a minimal contact between skin and shampoos as the prolonged contact can cause irritant dermatitis. Diaper area is moist and is prone to maceration. Moreover, it is frequently exposed to microorganisms. Therefore, the nappy of the baby should have good absorbent properties. Mother should be advised to frequently change nappies. Soiled nappy area should be wiped from front to back so as to prevent the soiling of urinary orifices. Soiled nappy area should be cleaned with lukewarm water and dried with soft cotton cloth. The skin should be dried and aired between nappy changes. In presence of napkin rash, emollient like petrolatum jelly or zinc oxide containing pastes can be applied. Powder should not be applied as they may form crust which can be difficult to remove and can cause trauma during its removal. Oil application decreases transepidermal water loss and improves weight gain in preterm neonates. Hence, it might lead to reduction in hospital stay. In Indian scenario, vegetable oils like coconut oil, sunflower oil are used for baby massage or emollient action. It is important to realize that the mustard oil can cause contact dermatitis and hence it should not be used in care of neonates. As the skin of extremely low birth weight neonate is very fragile, the oil application should be avoided in ELBW neonates in the first week of life. It can however be given after first week if the baby is hemodynamically stable. While doing procedures, we should avoid excessive pressure during the skin preparation as it may cause skin trauma and resultant antimicrobial attack. For fixing temperature probes, intravenous cannula and feeding tubes, a semi-permeable dressing, for example Tegaderm, should be used as a base over which further adhesive should be applied. We should avoid bulky dressings as it may cause skin damage during its removal. To minimize skin trauma during removal of adhesives, it should be moistened, which makes it easy to remove. To facilitate that, a wet cotton ball is soaked with warm saline water which should be applied for some time over the adhesives. To summarize, in this webinar we have learned that the cord should be kept dry and nothing should be applied over it. Vernix caseosa should not be forcibly removed as it automatically falls after some time within 24 to 48 hours. Vernix should not be removed forcibly after the birth of the baby. Bathing should be avoided in hospitals. Instead, sponge the baby while the baby is hospitalized, and bathing can be resumed after discharge. Diaper area should be kept dry and should be wiped gently when soiled from front to back. Coconut oil should be used in healthy low birth weight neonates. However, it should be avoided in first week in extremely low birth weight neonates. Semi-permeable dressings should be used as a base whenever adhesive application is required. We should always avoid bulky dressings during such procedures. Thank you.